Hello friends, let us now learn about the vascular anomalies. In the last class, we have learned about different developmental anomalies of the liver, starting from agenesis, anomalies of the position, accessory fissures or diaphragmatic fissures, and true accessory fissures of the liver is done. Now let us learn about the vascular anomalies of the liver. Vascular anomalies. So in the vascular anomalies, first, celiac artery. Celiac artery, right. Celiac artery is actually a branch of abdominal aorta. The anterior branches of abdominal aorta include celiac artery, superior mesenteric artery, inferior mesenteric artery. So, celiac artery gives rise to three parts, three branches. One, common hepatic artery. One is common hepatic artery. Second, um, we have right gastric. Sorry, yeah. Sorry, left gastric artery and splenic artery. We have left gastric artery, common hepatic artery, and splenic artery. So these are the three branches of celiac artery. Now this common hepatic artery again divides into two branches. One we have right hepatic artery, second we have left hepatic artery. So we have right branch and the left branches of hepatic artery. Right. But there are some variations in this anomaly, this is normal. Normally, celiac artery gives rise to three branches. One, left gastric artery, common hepatic artery, and splenic artery. Common hepatic artery again divides into right and left hepatic arteries. But if the left hepatic artery, there are three variations. The left hepatic artery, actually, it should originate from common hepatic artery. But instead, if the left hepatic artery originates from left gastric artery, that is, left gastric artery is giving rise to left hepatic artery. Similarly, if the superior mesenteric artery gives rise to right hepatic artery in 11% of cases. And superior mesenteric artery also gives rise to common hepatic artery in 2.5% of patients. So, normally, celiac artery gives rise to left gastric artery, common hepatic artery, and splenic artery. Common hepatic artery again gives rise to right hepatic artery and left hepatic artery. But in 10% of the patients, left gastric artery gives rise to left hepatic artery. In 11% of patients, superior mesenteric artery gives rise to right hepatic artery. In 2.5% of patients, superior mesenteric artery gives rise to common hepatic artery. So these are the vascular anomalies or variations of origin of the right and left hepatic artery from the celiac artery. Then the next anomalies of vascular anomalies include congenital portal vein anomalies. These congenital portal vein anomalies are actually uncommon. These congenital portal vein anomalies are not common. They are, that is, the portal vein is normally formed. But if the portal vein is not formed at all, that is atresia, where the portal vein is not formed at all. Second, there can be strictures can also be seen in the portal vein. That is, strictures can also be seen in the portal vein where the two walls of the portal vein, the lumen of the portal vein is obliterated and the two walls come close to each other, leading to strictures of the portal vein. Or there can be some obstructing valves of the portal vein. So if you remember, portal vein is one of the valveless veins. Normally veins will have valves. Any vein in our body starting from um, starting from all the veins of our body have valves, but portal vein does not have valves. But if there are valves present in the portal vein, then this is also a congenital portal vein anomaly. So the portal vein anomalies can be divided into atresia, strictures, and obstructing valves. Then, second, variation in anatomy of the portal veins. That is, actually, there will be portal vein. Portal vein is also divides into right portal vein and the left portal vein. So portal vein will also divide into right portal vein and the left portal vein. Now, in some conditions, there can be absent of portal veins. Okay, that is one variation. Then, if there can be some anomalies in the branching of these branches. Normally, the portal vein gives rise to left and right portal veins. But if this branching is not proper, or if the left portal vein is absent, so in all these conditions, there can be variations. All these variations can be seen in the portal vein anatomy. Then, most common accessory veins. There can be some accessory veins also. Okay, these accessory veins are present additionally. Accessory is some additional veins which can be present in our body. So there can be an accessory vein which drains the eighth segment, that too superior anterior segment of the right lobe, which is the eighth segment of the liver. So this there can be accessory vein draining the eighth segment of the liver, and this accessory vein is seen in 1/3 of the population. So it is seen in 1/3 of the population, and it usually empties or it drains into the middle hepatic vein, or it joins the right hepatic vein. So if you see, this is the liver according to the Conrad segment of liver. This is 2, 3, 4A, 4B, 5, 6, 7, 8. So there is a vein which drains the superior anterior segment of the right lobe, which is nothing but the eighth segment, and this is an accessory vein. Okay, it is present in 1/3 of the population, and this accessory vein will empty into the middle hepatic vein. It empties into a vein which is called as middle hepatic vein, or it occasionally joins the right hepatic vein. So this is one of the accessory vein. Then we can also have inferior right hepatic vein. This is also an accessory vein. So if you see, if this is the liver, this is second segment, third, 4A and 4B, 5, 6, 7, 8. Okay, so there is an inferior right hepatic vein. So this is inferior right hepatic vein. Okay, so this inferior right hepatic vein drains the fourth segment of the liver. This is the fourth segment. So this inferior right hepatic vein will drain the fourth segment of the liver. Okay, now this inferior right hepatic vein is not present generally. It is seen only in 10% of the patients, and this will actually drain into the inferior vena cava. So this inferior right hepatic vein will drain into the inferior vena cava, and this is actually larger or equal to the right hepatic vein. This is larger or almost equal to right hepatic vein. So this is called as, this is one of the accessory vein present in the liver, which is called as inferior right hepatic vein, which is draining the sixth segment. Sorry, this is not fourth, this is actually sixth segment.
Thank you and thank you for watching.